Ghanaians believe that Ghanaians believe that their transformation will not occur on the back of parties, but on the back of leadership. It's a question of leadership.
All right, Ghana's health sector has made some significant strides over the last 2 decades. However, there's still a lot more to be done. Today on Alan Speaks, I get the opportunity to again sit with the man himself, Alan Kyerematen, and we are going to run through his health sector policies in the Great Transformational Plan. I'm excited because the wealth of the nation resides in its health, or the health of its people. And so we are going to be dealing with all the sectors that finds expression in the whole, which is the health sector. Thank you again for joining us.
Thank you very
on
much,
Alan Speaks.
Good to see you.
Likewise. You're looking good. And
you're looking good too.
You were campaigning. I would have expected that by now you'd be drained. But the energy is there.
It's by the grace of God.
Yeah. And look, the last time I received calls from the northern region, and people are following. It's
amazing. I've also received calls from the north, and it looks like the Pan-African network, television network, is very powerful platform in the 5 northern regions.
Yeah, we're the best. And there are some people living in some other African countries. I'm sure very soon you start receiving calls from Gambia, Senegal. Yes.
That's good.
So congratulations. I mean, it's not easy campaigning and traversing the length and breadth of this country.
Yeah.
What are some of the experiences so far? Can you share with us some of the experiences so far?
The message cuts across all the regions that I've been to. The majority of Ghanaians are looking for change. They are tired of both the MPP and the NDC. That seems to be translating into 2 options for them. Either will not vote at all, or if there's a credible alternative, then we'll consider that. Yes, Alan has given an indication that he would run, but we need to be sure that he's actually going to run, because there are rumors that yes, the MPP are trying to bring him back, but there's a message I get. But if they are telling me that if Alan, you confirm that you are running.
Today, we have a very daunting task because we're going to look at the health sector. Plethora of issues come to the fore. What makes me happy is the fact that you've actually sat down to think thoroughly with your team about the health sector. And you have devised a strategy that is feasible, that is pragmatic, that is achievable.
And sustainable.
Brilliant. So we are going to be looking at that. First, give me your general overview of the health sector. And then we look at the pillars that you have devised for the purposes of ensuring that all the things that you have identified through the research and the data that you've gathered relative to the issues with the health sector, for which reason you devised, this strategy, you share them with us. So let's look at the general overview of how you see the health sector in Ghana and whether or not we have been able to perform well as a nation.
Kwame, as you rightly pointed out in your opening remarks, a healthy nation is a powerful nation. And going back the years, from independence, we've always had significant challenges with our health sector. Significant challenges. And they relate to health infrastructure, health service delivery, the human skills requirements, and even the institutional architecture in terms of what type of institutions have we established to support health delivery. So if you look at the health sector based on these component areas, it will give you a sense of what has been done, what is left to be done, and what it will take us to fill the gaps. So this is the analytical framework within which we've approached this. But going forward, the strategic objective of the GTP and the movement for change and the Alliance for Revolutionary Change is to progressively move Ghana towards universal health coverage. Okay. So I'm choosing my words.
Universal health
coverage
progressively. So it is not, an immediate one day thing
over a period of time. And that's where all countries would want to be. That is the strategic objective of any powerful economy. That's where they want to be. So I'd like us then to look at the health sector from these various component parts, infrastructure, delivery, financing, and those areas. And then we can delve into some of the options or policy prescriptions that we are providing.
So the first five, for the purposes of explanation, I just want to put them out so that we take them one after the other and we explain them. So we are looking at health infrastructure. We are looking at health service delivery. We are looking at human capacity development. We are looking at institutional architecture. So let's look at the health infrastructure. Okay. Of course, I mean, it's right. Everybody knows that in terms of infrastructure, health-wise, we are in some huge deficits.
Very much.
And so what do you intend to do to ensure that we at least close that gap?
First, we are proposing that we are not starting from scratch.
Okay.
In terms of health infrastructure. So we want to undertake a comprehensive assessment of all the health facilities around the country over the years so that we document exactly where we are with our health infrastructure. And then once that assessment is made, based on that findings, we can then develop a program and we've stated it very well in we said, then we develop a program for the renovation, rehabilitation, retrofitting, expansion, completion, or commission of the identified public health infrastructure facilities. So what this means is that we have an assessment of the existing health infrastructure, because we have to be frank about this. It is not as if nothing has been done over the years.
Right.
But what is the state of what's the existing what's the current state of those existing infrastructure? So that's where the assessment comes in. Now, once you do the assessment, then you have a basis for filling the gaps. And what would the filling of the gaps involve? That's what we've indicated here. In some cases, it will just be a question of renovation. In some cases, it's rehabilitation, because these are different things you can do. In some cases, it's a question of retrofitting.
Right.
So you might find that there's no problem with an existing structure, but in terms of the facilities and the equipment, it requires retrofitting. Then in some cases, it will be expansion, because you need to expand and extend the scale. In some cases, they are under construction, but the issue is, when will they be completed? So in some cases, it will be completion. And in some cases, you find that it's just a question of it's been completed, but it cannot be commissioned because you don't have the personnel or you don't have the working capital to get it off the ground. So you can see that this will be the first time that we are undertaking a comprehensive assessment of infrastructure all over the country and actually responding to them. So it is only when this is done, then we can start thinking about what are the gaps that need to be filled. So if, for example, through the assessment, you realize that, look, we have great facilities at the regional level, but we don't have enough at the district level, or we don't have enough at the rural community level, then it becomes very obvious where the gaps are. You know, and we've gotten to a stage, Kwame, where we need to be very detailed and strategic and analytical and comprehensive about our policy options.
Absolutely.
And not just having a certain attitude of making statements, you know.
Rhetorics and platitudes.
Yes.
Without
that we want to build 100,000. It doesn't work that way.
It doesn't.
What is there on the ground now? What is the state of what you have? What are the gaps? And that's where it starts from. Now, once you've done that, you can get into some other major policy interventions. And we've proposed, I mean, apart from this assessment, that reconstruct, and again, we have to be careful. We understand the
reconstruct.
Reconstruct incrementally in phases. This is what it says. You know, as lawyers, our choice of words are important. And intentional. Reconstruct incrementally in phases. The two leading specialist tertiary teaching hospitals, namely Kolebu and Konfanoche Hospital, on their existing sites. Look at the strategic location of Kolebu. Look at the strategic location of Konfanoche. Previous governments have been doing retouching, you know, and refurbishing of wards of both hospitals. But this is not how to go about it. These are major installations in strategic location. So what this is saying is that instead of doing just rehabilitation of wards, we reconstruct incrementally. You're not going to pull down the entire Kolebu, but you start in phases incrementally and do complete reconstruction. That is where within a matter of 3 years, you have a new Kolebu, you know, properly fitted, and the same with Konfanoche. So, because look, the two, what we call specialist tertiary teaching hospitals, these are great assets. I mean, that can be compared with any infrastructure around the world. However, if you look at the nature of the infrastructure, obviously something has to be done about it. Yes. Then you have, it says, provide appropriate healthcare equipment and logistics to ensure effective operation of all other healthcare installations. So it's not just Kolebu, and then, you know, we have other great installations like the UGMC, like Rich Hospital, and some of the other regional hospitals. So that's the kind of thing.
This is another infrastructure. I mean, when I was doing the research, I stumbled on a few things that I think maybe may interest you, that you may want to react to. So under the infrastructural deficit of this country in terms of our hospitals, you know, we're looking at inadequate hospital facilities. We're looking at limited healthcare equipment. We're looking at inadequate water and sanitation facilities, poor road network, inadequate storage and supply chain management, limited telecommunication infrastructure, inadequate waste management, limited specialized care facilities, inadequate healthcare worker accommodation, and the list goes on and on. But what is actually very staggering is the fact that we have, you know, the hospitals. We have about only 55 hospitals for a population of 32 million. So it finds expression in what you're saying. But, you know, once you identify the problems, we'll be able to now either construct new ones, you know, in areas where we feel that we need to construct those new ones, or better the ones that are already in existence. Now, we are saying that the hospital beds that we have in this country, we're looking at, only 19,000 hospital beds. We're also looking at, over 40% of healthcare facilities in Ghana lack basic infrastructure like water, sanitation, and things like that. So technically, what you're saying is that under infrastructure, you're going to ensure that all of these things
absolutely
are looked at.
Based on the assessment. Once you do an assessment for each facility, waste management, water supply,
right,
all the things you talked about,
right,
that will be the criteria for the assessment.
Right.
And it becomes then very easy for you what needs to be done with respect to the existing ones.
Okay.
But then it goes back to, so what are you going to do to fill the gap? That's where you have no infrastructure. What is the approach? And that's what, but I must say though that it also now leads into government support for private sector.
Yeah, I was going to come to that.
Yes, because all the things that we'll be talking about is public sector health infrastructure.
Yeah, yeah.
Now, what the GTP is saying is that, look, there's no way that we can fill the health sector infrastructure gap just through public sector financing. So the GTP is saying that provide incentives to the private sector, and we choose our words carefully, to build, own, and operate what we call community hospitals in all peri-urban centers and towns across the country on a work and pay basis. So you're a doctor, you come out of medical school. Government provides the working capital for you and also the capital expenditure requirements to construct community hospitals in towns. So this goes even further down the track or the lane from just having agenda district, agenda 111 district hospital. Then when you look at agenda, this will be great as district health facilities. But move further into the towns and the communities. You see, there's a very big gap. There's a gap between the rural health infrastructure and the urban.
Right.
So you fill the gap with the community hospitals. But government does not need to invest in these. You provide the financing support on a work and pay basis to the private sector. So immediately you are revolutionizing health delivery because you give the private sector a standardized design for a community hospital.
Do you want to call it one district, one hospital? Because
absolutely,
yeah,
or one town, one hospital.
One town, one hospital.
Because the district is the agenda 111.
Right.
But this one is one town, one hospital.
Wow.
A great brand. And,
one T1H.
One T1H. And you see, this is not rhetoric because it will be supported. Yes, there's a plan to it.
Now, let's look at how to finance these things.
Yes. Okay.
Because the financing of healthcare is financing of healthcare on the National Health Insurance Scheme.
Yes.
Which, in my estimation, has become moribund because it's not as effective as we thought it would. Particularly because of all the issues that we've had. Now, how do you intend to use that to the benefit and the advantage of the Ghanaian people?
So, Kwame, the way this works is that in all jurisdictions, it is the National Health Insurance regime that supports both the public and the private sector of health institutions. So it doesn't matter whether these are public facilities or private facilities. Once you have a National Health Insurance program, then the financing of the activities in this health facility or infrastructure, it is covered by the health insurance fund. That is what happens in all economies. So you need to make the National Health Insurance a viable scheme. That's the first thing. And to make it a viable scheme, if you read
to strengthen the operations of the National Health Insurance Authority.
We haven't had an audit of the operations of for a very long time.
That's a fact.
And you know that this whole NHIA in every country is fraught with all kinds of, challenges, very negative practices all over the world. So you need to be able to audit the operations of the NHIA and make sure that you eliminate the leakages and the fraud associated with the NHIA. But also, then you need to increase the health coverage, the benefit package under the scheme, because currently the type of ailments that are covered does not extend to what I would describe as other very important health conditions. Right now there's a big incidence of kidney diseases, liver, all these things. These are not normally covered under. So what we are proposing is that make the NHIA more viable, financially viable. Then you can extend the coverage. So it's a major part of it.
Well, that's brilliant. I mean, you said that you want to increase the national health insurance premium too, extending the benefit package and coverage under the scheme, and then granting special dispensation for the non-payment of premium to citizens who are verified to be unemployed. Can you expand on that?
Yes, because right now the current premium for NHIA is very small. I mean, compared to the premiums in other countries. But if you are unemployed and you don't have an income, it means that even if the premium is highly subsidized, you still do not have an income to be able to afford it. So how do you cover unemployed people? So that is what, this will be a revolutionary step, because those who are unemployed can then still benefit from the national health insurance.
I think that's brilliant. You should look at that. Let's look at the second point. You want to provide catalytic working capital funding at subsidized interest rates to support the efficient and effective operations and management of privately owned healthcare facilities based on agreed criteria.
So we've said that the public or the government cannot do this alone. You need to bring in the private sector, including the proposal that you provide financing for doctors to construct their own private clinics and hospitals. Now, once you do that, they need working capital to be able to run. And so we are saying that now you facilitate access to working capital at subsidized interest rate, because they are supporting the health conditions of all Ghanaians. So you are not expecting that they will borrow at the same rate in the market. Otherwise, they will pass it on. And then that becomes counterproductive. So that's what this means.
I'll be going for a quick break very shortly. But before then, let's address the third point, which for me is actually very, very important. The third point having to do with the proceeds from the National Health Insurance Levy. And I like how you couch it. I like how you describe how we are suffocating the funds that we generate from national health. You said you will ring fence it.
Ring fence in the sense that, Kami, I'm sure maybe you already are aware that you have a situation where we all pay a levy of 2.5% on all transactions. So where does the money go to? In some cases, you realize that the money that is intended to support the NHIA, because these are levies paid by all Ghanaians on all transactions. The monies are channeled to support other things which have nothing to do with health. So we are saying that for purposes of the NHIA, we must ring fence, meaning that we should not touch the proceeds from the levy, because that's what it is meant for. Now, as long as it is levy, then we must make sure that we protect that levy and ring fence. That's what the ring fencing is. And then we must make sure that we are channeling it directly to support the NHS.
This is brilliant, and I love it. Introduce comprehensive digitalized audit system
Yes.
To eliminate ghost names. I'm sure you're talking about ghost names.
It's a ghost, the same thing.
You want to be diplomatic about it.
Yes, absolutely, yes. So somehow the ghosts in Ghana don't only appear on the payrolls, but also in the NHI, it's a major challenge. All kinds of fraudulent practices. So the only way you can have a proper audit system is to digitalize it.
Absolutely.
Yes, and once you digitalize it, then you have
absolutely. Finally, establish a special fund under the NHI to subsidize the cost of managing complex chronic diseases.
Yes, complex chronic diseases, cancer.
Yeah.
Those
terminal ones. Yeah.
Those terminal ones. You have no idea the amount of money that people have to put into the cost of looking after patients.
Very expensive.
For these chronic
Hold that
diseases.
thought. Quick break. Stay with us. Alan Speaks with me, Kwame Owusu-Danso.
I say, you be who know me who be when I say, the echoes of the so when I say, be the question by baby me. I say, the ref is a bit dry. I say, Alan Cash. I say, this car calls upon wine. I say, and the car labash. I say, that's a blue cannibal. I say, never buy balu. I say, my live in the bride. I say, everything I do. I say, before shine your eye. I say, before you shine your shoe. I say, well I won't nine it. I say, you want to work on boo. I say, hey, I say. I say, Munjai de. I say, I say, I come like Alan Cash. Alan Cash, plenty money for my bank. I say, for my bank. I say, I say, I say, Munjai de. I say, I say, I come like Alan Cash.
Welcome back. Very honest conversations here on Alan Speaks Primetime TV show. My name is Kwame Owusu-Danso again, and we are talking the health sector of this nation. Honorable Alan Kojo Chemantin, for the purposes of bringing better and insightful explanations to the health sector policy in the Great Transformational Plan, has decided for us to have this conversation so that at least you will understand the prescriptions tabled, so that we can all, when he becomes president, we can question him. But let's look at health service delivery. It's one of the areas that, within the health sector, we have serious challenges. How are we going to restructure, the health service delivery so that, we can benefit from same?
We've talked about the infrastructure. We've talked about the financing. But the real deal
is the delivery of the service.
Yes, because you can have beautiful infrastructure, but if the delivery itself is deficient, then the infrastructure doesn't mean much. So what we're saying is that the delivery has to be at different levels.
Okay.
At the rural community level, what the GTP is proposing is that we want to restructure the operations of what they call CHIP compounds. This is at the basic level of the health delivery regime. That is at the rural communities, which used to be called health posts. Now they are called community-based health planning services, CHIPS compound. And it's very important because this is the only access to health service delivery by rural communities. And we want to be able to restructure the operations of these CHIP compounds and improve access to quality healthcare from the CHIP compounds.
That's brilliant.
Because the majority of the people in the rural areas cannot have access to healthcare beyond the CHIP compound. So we have to make sure that we fix the CHIP compounds, make them more efficient and effective, and then you can extend good health coverage to to those who are marginalized. So this is what it means. But it goes beyond the cheap compounds. Now, in matured economies, they have what they call the general practitioner system, the GP system. So every community would have a general practitioner. That's a doctor who is generally called a family doctor. And he has for responsibility, let's say in this area, which is this area. Abiling, yes. So you probably have one or two GPs, family doctors, who have been zoned to cover the people in this particular area. And so the GP will be the first point of call for every individual within a neighborhood. So you don't just start moving to Kolebu from Jowulu. First you need to be assigned to a GP, and the GP then, because these are qualified doctors, they will do the first level screening and then determine what has to be done. If it is something that they can handle at their level, they will do so. Because these are qualified doctors, and they don't need to be operating from hospitals. They have smaller, I would say, facilities. And it means that if you introduce the GP system, particularly in the urban and peri-urban communities, in all neighborhoods in Ghana, you have general practitioner.
It's more like, so will it be like a mobile general practitioner?
Yes.
And how then do you check to ensure that these are qualified general practitioners?
Oh, yes, before, because it's going to be part of the Ghana Health Service.
Okay.
So you have to register as a GP.
Okay, all right. Okay.
And the professional screening, all will be done by the Ghana Health Service. And then the professional association, the medical association.
Okay, so that we check these quack doctors and things like that.
Yes, you are right. So that was your worry.
Yeah, that's my worry.
No,
these quack doctors will take advantage of.
These are qualified, but I mean, you want to get more people in the private sector who are involved in healthcare without necessarily having to operate from hospitals.
I agree.
So many of them actually come even on visitations, home visitations. So you go to your family doctor first, or your GP, or they come to you. And it's the same thing as going to a hospital.
My question is, would there be a way of verifying the people who will be coming to our homes so that we know that this one is who he says he is?
Yes.
So you're going to have like a digital system where you can scan.
You can scan.
And then we'll verify
and
that,
then you
this
know
is
that this,
so they'll have a barcode.
Oh yes, they'll have a barcode
with the ID tag.
ID tag. And almost invariably, everybody within a neighborhood will know that this is their GP.
So these are Kwesi-Menu.
I agree. So these are licensed by the Ghana Health.
The next point is something that we've discussed before. Installation of health screening booths.
Yes.
We've discussed this
Fantastic
before.
idea.
Brilliant idea.
Yes.
More like a mobile money joint.
Yes.
So this will be health money joint.
Yes.
I mean, health screening joint. So, I mean, once you are a graduate, or you're a health professional, or
even
you're a
an
nurse, SHS leaver, you can apply
to own one of these booths. Because when we say booths, it's like a very well designed kiosk. Because all you're doing there is to do health screening, checking of your pressure, your sugar. You don't need to go to a hospital and overload the hospital infrastructure just because you want to check your blood pressure. So these health screening booths or joints, very nicely designed, very small kiosk or units.
Advantage points.
These are all
marketplaces.
Yes, marketplaces.
Very specific.
Let's say every 2 kilometers then you have one. So because that's where it starts from. If you have access to health screening, checking, and we can then make referrals from the health booths to the GP. You see how it all works?
I agree.
Yes, once
would have the details of the GPs, and then they will refer the matter to the GP. If indeed they have
the boots will now make a reference.
And then when it's critical, then the GP will refer you
to the next level. Yes.
So they can even...
When I say,
right. So even for the people who would man the booth.
Yes.
That would be about, because if you're saying
100,000
booths, 100,000 jobs. In fact, times
100,000 jobs.
That's times two, because I mean, sometimes you want to have someone who keep records.
Yes.
You know, assistant who will keep the records. So
and the beauty, who keep the records. The beauty of this is that, number one is jobs, quality jobs.
Yeah, this is decent jobs.
And
you can even flex,
I'm sure you're almost like
a mini doctor.
A mini doctor.
Yeah.
But of course, you have to be properly trained.
I
mean, just to check your, it's not that complicated to check your vitals, as we say in Ghana, to check your vitals. And in this case,
how would you connect this to the pharmaceutical system? For instance, if somebody's BP is high, and they check it, then, and then it is referred to the GPs. Will there be some form of collaboration between the GPs and some selected pharmaceutical
Absolutely. So that's the other part of the.
And then explain that one.
So because now it means that in every community there will be booths, health screening booths. There will be GPs assigned, and then there will be licensed pharmacy shops. Licensed pharmacy shops within each community, so that it is properly integrated,
right?
And it's community based or neighborhood based in the pharmacy. So if this does not require a referral, then all that will be dealt with between these three players,
right?
The screening official, the GP, and then the pharmacist. So that now we can properly locate pharmacy shops.
I agree with you.
Yes.
I agree with you. Look, I love this. I love this. And, I think that you should give it an opportunity to really implement this. Yes. Now, beyond this is also so what it means is that you would have solved a very major problem easily.
Very much so.
What would otherwise become a bigger problem for which reason we have to refer other people. So the referrals will be for very, serious matters.
Very serious matters.
Yes, emergency situations.
You don't walk into a regional hospital or even a district hospital.
Yeah. Until it's critical.
Until you've been referred by the
GPs.
By the GPs.
This is brilliant, honestly.
Yeah.
Now, based on that, you said that you want to still upgrade existing regional hospitals to the status of specialist referral hospitals across the country.
So it means that we are sanitizing the entire health sector. Once you have this lower level health delivery regime, as we just discussed, then it means that district hospitals and regional hospitals then become referrals. And then you don't have everybody trooping in there. Because you are now taking health care to the doorsteps. To the doorsteps of the individuals. Doorsteps of why should you walk into a health facility to go and check your blood pressure?
It's like back in the day when we had the summer. You come to the house.
Yes. So it's the same thing. Right. Then it means now that regional hospitals and even district hospitals would actually become referral hospitals. And then the pressure on these facilities will reduce.
So that we can even deal with the issue of the low bed syndrome. Because then it's not everybody. They won't wait to get to that point where they need beds.
Inpatient, A lot of this is just outpatient care that is required. Before then you get into the real big teaching hospitals that we are looking at, either Kolebu.
Right. Okay. That I mean, it can easily be achieved, to be honest, because then it means that you'll not be burdened with the promise of facelifting the already existing big hospitals. Then you start small, and then gradually you can build on it, and then you feed into the general. That's good. Now, most of the diagnostic centers we have in Accra are very expensive.
Very expensive.
And the labs
you go
very
for a lab
expensive.
test.
Yes.
That's almost like twice your monthly salary.
How would you address that?
So the GTP is saying that we'll provide funding at subsidized interest rates to the private sector, because the focus of the GTP and of my government, my presidency, if I voted as president, would be to use the private sector as a vehicle to deal with literally almost all the But then to do that, government has to facilitate and provide incentives. And that is why it says that, yes, these laboratories are privately owned, but then government has an interest in making sure that the cost of laboratory services are affordable. And the only way this can be done is to make sure that the government then provides subsidized interest rates and working capital for the privately owned diagnostic. It will completely change.
It will help us.
Yes.
It will help us.
Yes.
A great deal.
Because you have no choice. Going to a medical facility, no serious doctor would probably look at you for, let's say, for a serious ailment without you doing a lab test. You know that.
What is your plan for, and I thank you very much for this particular answer, because it will help us a lot.
Yeah.
But what is your plan for the Herbal and Traditional Medicine Association we have in Ghana? Because right now,
it's a very powerful group.
Very, very powerful group.
And you know, KOD, that I would dare say that about 60 to 65% of all Ghanaians they use they use herbal and traditional medicine.
Absolutely.
All the people in the rural communities, so we have ignored these herbal, I would say, treatment opportunities. And until you get into real trouble, then you realize that
start looking for them.
So because of that, we are not properly regulating their practice. And we are saying that even though the current structure recognizes and acknowledges them, and there's a department, it's not properly integrated. There's a department for herbal. But this is not about, when 60 to 65% of all Ghanaians are using that.
Then it's a major player.
That's a major player. So what we are saying is that we will integrate fully herbal and traditional medicine in all public healthcare institutions. So you have an option once you get into a facility, either to go the herbal way or to go into the orthodox practice. And we want also to extend mental health facilities in all secondary and tertiary public health institutions. Currently there's an effort to have mental health units, but only within, I would say, a certain level of hospital infrastructure at the regional level and some district. But now we want to mainstream this throughout, so that mental health delivery is mainstream to our healthcare delivery system.
Labor Amendment Bill. For our wives, our mothers,
this is where the
real deal.
Yes.
Is it going to only benefit the women, or we too benefit small?
Currently,
yes, sir.
Women are entitled to, I think, 3 months health, let's say maternity leave. The GTP and my government is proposing 6 months paid leave. 6 months paid leave. So we are doubling because let's face it, our wives, our mothers, they are constrained because of this short period of pregnancy. This short period that is assigned to them. Some of them stay at work until almost they are about to deliver at work. Just because they want to take maximum advantage of the 3 months. So in this case, we are extending and doubling the maternity leave to 6 months. That's paid. And then we are also giving them an option of an additional 3 months, but unpaid. So that even if you have to stay 9 months, and when you have complications, it requires that, because we are a compassionate will be a compassionate government. My government will be a compassionate government.
Right.
That is protecting the welfare of women in particular.
Right.
And so in this case, you have 6 months paid leave, 3 months unpaid leave, and that's optional because it's unpaid.
Yeah.
But if you take advantage of it, then you have 9 months. Now, then the icing on the cake is that men, the men
Yes.
would have 3 months paid paternity leave. 3 months paid paternity leave. So it means that between the man and the woman, if you combine what the GTP is proposing, you have 12 months.
Yes, 12 months.
You know, some paid and some unpaid. Yes.
We will take it. Like
We'll
that.
take it like that.
Now, listen, let's look at the other aspect of it before we look at the human capacity development.
Yeah.
Let's look at institutional architecture.
Yes.
You want to review and rationalize the mandates of all public institutions and agencies in the health sector and consolidate those with overlapping functions. It appears that it cuts across the board in your policy.
You're right.
You want to consolidate some,
because
take out the irrelevant
if
ones.
you remember, we're talking about reducing expenditure in the public sector.
Indeed.
And you have in some of these sectors, multiple departments and agencies doing the same thing.
Yeah.
You know, I remember I talked about the energy sector,
Yes.
where you have literally about 30 different departments and agencies. It's the same thing with the health sector. And we will save a lot of money by consolidating some of the institutions. That's what we mean by the institutional architecture.
Okay.
But also, we want, as we just we talked about a few minutes ago.
Yeah, the traditional.
If we want to mainstream herbal practice, medicine and practice, then we will establish a new authority for herbal and traditional medicine, separate from the Ghana Health Service. So now there are 2 branches.
So Ghana,
the Orthodox,
and
then
so Ghana Herbal and Traditional Service, for instance.
Health Service, Health Delivery Service.
And finally, you want to strengthen the oversight responsibilities of Ghana Medical and Dental Council to regulate the practice of medicine in both public and.
And you made a very important point about eliminating the incidence of quack doctors.
Yes.
And we feel that government has an interest in supporting these professional bodies, even though they are private professional bodies. Government has an interest in supporting them so that they can enhance their oversight facility, and that's what this is all about.
Right. So now let's look at the final leg, which has got to do with human capacity development. Now, and you are very consistent.
Yes.
You are very consistent in your great transformational plan, that where you want to provide some fiscal and non-fiscal incentives, you state it, and it cuts across the board. So you want to provide fiscal and non-fiscal incentives to the corporate private sector to contribute to the establishment of a special fund dedicated to improving the work environment for health workers in the public sector. So this is different from, creating a fund for.
Yes.
So
because remember we talked about the National Health Insurance.
Absolutely.
So that the levy, the process from the levy goes into the NHIA. Yes, that's the NHIA. And everybody pays the levy.
Yes.
But we are saying beyond that, government will support the private sector to make money. This is the whole thrust of of my government, that we are going to make businesses make money. We are going to make private business make money, entrepreneurs to make money. Once they make money, then we want them to contribute part of their profits to support a fund which is different from the NHIA fund. Then that fund, funded by the private sector, will also now be available to improve the work environment for health personnel. Because the government may not have the capacity to improve the conditions of service for health personnel. But we know they are very important. Everybody is important, but you're talking about teachers and health service personnel.
Right.
I mean, they take care of everybody. And so it's not the NHI alone that can support health workers.
Yeah. Let's now box all of this together and discuss it in under 1 minute. I mean, because of course they are all the same in my estimation. Human resource capacity building, and then also deployment and placement of qualified workers, particularly within government facilitated, privately owned health facilities, and then also comprehensive assessment of the human resource and skills requirement for health sector. So generally, you're just simply talking about the fact that there's a big lacuna there.
Yes.
And that lacuna has been, whether intentional or otherwise, created, for which reason people are not given the opportunity to work in that space.
You've gone through school.
Yeah.
You've gone through a health educational program, trained nurses, and they are sitting at home because there's no clearance there's no clearance for them to be posted. It doesn't make any sense. So it means that we are spending money on training people. And then, so what we are saying is that once you're trained by taxpayers, it doesn't mean that you can only work in government. But now government would support private sector facilities, because remember, we've said that government is going to pump money to the private sector to establish their own. Okay. In this particular case, those who are trained nurses now can go either to the private hospitals or clinics or the public, because now government is going to support the privately.
But then again, your government also promises that even in the event, so it will be an option.
Yes.
Even in the event that you don't want to go to the private or the public, there's also a policy that will send you abroad so that you go and work and bring money home.
Go and bring money home. We talked about this skills, Ghana skills export.
Absolutely.
And there's a huge demand.
Absolutely.
For nurses. And other healthcare personnel.
But we have to streamline it.
We have to streamline. Right now it's not streamlined.
Absolutely.
So that is part of our policy agenda, specifically to train health personnel.
You won't suffer much. Do you know why? Because you are talking about the 100,000 booths.
Yes.
And so if somebody is out of the nursing school and the person immediately cannot find something to do, there's an option.
Yeah, you can
also subscribe to the export of the skills.
Yes, skills.
You can subscribe to that.
Yes.
And then also the two other things that you spoke about, the private and the public.
Yes,
Quick break, we'll be right back.
I say, you be who know me who be when I say, yeah, cause of the air, so when I say, be the question about you may I say, the ref is a bit jarring I say, Alan Cash, I say, in this car calls upon wine, I say, and the car labash, I say, that's a blue cannibal, I say, never pie balu, I say, my in the bride, I say, everything I do, I say, before shine your eye, I say, before you shine your shoe, I say, well, I won't nine it, I say, you want to work on boo, I say, hey, I say, I say, Munjai, I say, I say, I dey come like Alan Cash, Alan Cash, plenty money for my bank, I say, for my bank, I say, I say, I say, Munjai, I say, I say, I dey come like Alan Cash, I say.
Welcome back from that quick break. This is still Alan Speaks Primetime TV show. My name again is Kwame Usuda. So people are saying I should add the Esquire, so I'll add it. Esquire. And we are in some deep conversations with the Honorable Alan Kojo Chematin, founder and leader Movement for Change. And Movement for Change, I'm sure you are aware, that is contesting in this year's general elections. The good thing, and this is a novelty, no presidential candidate has ever done this before, to have a one-on-one conversation explaining their policy to the ordinary Ghanaian. Nobody has ever done that. So kudos to you on that one, Honorable, and to your team actually for this ideation. You know, sometimes if you have a team that is full of themselves and they don't want to, you know, you suffer for it. But your team has put this together, and I'm happy to see that people actually love it because they are now beginning to appreciate the other political parties are looking for it. I tell you, well, we'll get there. But what is most significant in the GTP is the identification of a problem that has bedeviled this country for a long time. You know, a problem that we've not been deliberate about addressing. Now, it has to do with the vulnerable in society. Persons with disabilities, the aged. What makes me settled is the fact that you have not just identified the problem, but you are saying that I'm going to do something about it. Alan, please, with the greatest of respect, I'm not going to ask you any question because I know that this part of the policy is dear to your heart. I've engaged you off camera, and you've told me how you care so deeply about the marginalized in society. We've had this conversation. You've told me about the fact that, Kwame, we have people living in the villages who do not have any, you know, health insurance policy, and they are struggling. We have to do something for them. You told me about the fact that, you know, the marginalized society is not just even about the person with disability, but it's also the people who, through no fault of theirs, were not able to get education, and they are on the streets. You want to do something for them. So I want to allow you to educate us on what you intend to do for those persons who fall under or within this bracket.
No, so I'm happy that you've actually drawn within that distinction. That I'm deeply committed to supporting the vulnerable in Ghana. And when we talk about vulnerable communities, it's obviously first people with disabilities, because I've also always said that disability does not mean inability. And there are many people with disabilities all over the world who are performing, you know, wonders. Now, because God bestows on other capabilities beyond their disabilities. So God bestows other capabilities beyond their disabilities. So all we need is to be able to support their God-given talent. And that's why for us, people with disabilities are a major part of our family. And we have very specific policies. For example, we've said that we want to enforce existing regulations for the payment of a special percentage of the District Assembly Common Fund, which is by law supposed to go to people living with disability. Where is that money? Where is that money? The District Common Assembly Fund is being used now to do all kinds of things, including supporting political activity, which is actually illegal. When part of the Common Fund is supposed to support people with disabilities, and they don't have access to that percentage. And I want to enforce that legislation. Beyond that, even access to public buildings. You go to many public, and it shouldn't just be public buildings. It has to be public and private buildings and facilities. If people live with disability, in many cases, it has nothing to do with them. I mean, it's just through no fault of theirs. Should they be constrained in terms of even physically accessing public and private buildings? No, I think it is wrong. So even parking, that's why you go to other countries, even parking lots. There are parking lots that are reserved for people with disabilities. Toilet facilities that are reserved for them. So my government would ensure that we support actively PWDs, people living with disabilities. But as you rightly pointed out, there are other marginal groups in our society beyond those with disabilities. The aged. Look, at a point in time, we all become part of that group. There is no comprehensive program to support the aged. And it's very unfortunate. After, so many years, so maybe of hard work
as a young man,
for the government, or even as a private person, you transition into the aged group, and now everybody forgets about you. It's not fair. So retirement homes, all those things now for the aged is very, very, very important. That we say, provide incentives to the private sector. Everything is about the private sector. Government under my, or let's say the government under my presidency will make sure that we don't take upon ourselves all the things that people are promising when you don't even have the funds to do, but provide incentives to the private sector. They know where to find the money, but provide incentives. And if we do that, you will see the number of private retirement homes for the benefit of the aged that will be constructed. And just across the country, people are building luxury homes and things like that. Yeah. But if we provide incentives, fiscal and non-fiscal incentives to the private sector to build, retirement homes, you'll see what is going to happen in this country. So that our aged are not a burden to society. And they ought not, because they have looked after us before. They've looked at us before. So is that commitment that I'm making?
One other leg of that support that you're talking about, beyond the building of the facilities, also the fact that you speak about creating a special health care policy.
Yes,
that will cater to their needs, and also the fact that you created some form of like a LEAP system. That
absolutely,
especially with the aged in the rural communities.
Yes, in fact, currently we want to review the LEAP program. And then the school feeding program, because children are also vulnerable groups, and because there are so many challenges associated with the school feeding program and the LEAP. So many. I mean, if you listen to either people who are supposed to be providing school feeding as part of the school feeding program, so many, or whether it's NDC or MPP, and it's very strange that this occurs. So we're going to have an extensive review and make sure that these are effectively and efficiently done. But the icing on the cake, which I am committing my government to, is the fact that there will be what we call mother-child support benefit. It's going to be brand new, because look, whether you're a single mother, or you are married and you don't have any support for your children, we are going to provide child support benefit to all mothers for children, let's say up to a certain age, maybe 16 years or 18 years for that matter, and also for a certain number of children, where there's a package of support, benefit, cash grants that will be paid to mothers to support their children. Because it's not just waiting to get into senior high school. That's where you need that support. Look at our mothers, those in the farming community, those in the markets. How much do they earn selling the market to be able to support their children? So this is child support benefit specifically for our mothers, who are basically our assets, our great asset.
Like I'm just sitting here, going through your mind and feeling the passion with which you are putting forward this particular aspect of the policy.
Very much so.
And it touches my heart, because I'm somebody who really is interested in the welfare of the young and the aged.
Yes.
And I'm very happy that you factored this into your policy. Now,
and I've talked about the fact that, so where is Anam going to get the managerial machinery to support all these things? I'm establishing under my government or my presidency what is called the Ghana Executive Service Organization. This is a great program. In other economies, you have similar organizations where semi-retired and retired professionals who have the experience, the expertise, and the knowledge are all part of this organization, and they would support initiatives, whether it's the young youth-owned companies or some of the fantastic ideas under the GTP, which require managerial support, because it's all private sector. It's all private sector. But then, if you are over 60 or 65, you've worked, you have experience, but because of the age limit, you are now sitting at home. You are interested. You want to use the benefit of your expertise to support the GTP. So this great organization is going to do that.
Right. I mean, I've enjoyed today's conversation. We've come to an abrupt end of the policy. However, let us look at the campaign.
Yeah.
How has it been for you so far? And the perception that you are not contesting this year's election by reason of an impression that has been created by the MPP that you are going back to your fold. How true is that? And how has the campaign been so far?
I want to use this platform to make a public declaration that I'm not going back to the NPP, of which I was a founding member. I've explained the reasons why I left, and I'm not going back. And I'm contesting in my own capacity as the first non-partisan, and I want to use the right word, the first non-partisan independent candidate. Sometimes people are not too sure about what is an independent and non-partisan candidate to bring the country together, to have a government of national unity, a government by the people, of the people, and for the people, an all-inclusive government which will harness the talents of not just politicians, but yes, of politicians, of people in the MPP, in the NDC, in the smaller parties, CPP, but also people outside the political space. How is it that we have a political dispensation that is excluding everybody else who is not a politician? It doesn't make sense. It's not sustainable. In fact, the best people are outside politics. And my government and my presidency will make sure that we bring every talent, whether it's in Ghana or in the diaspora, to work for government. I'm not interested in working to secure the interests of political parties. I'm interested in working to secure the interests of Ghana, because it's about Ghana and not about political parties. The great nations of the world were not developed into great nations on the back of political parties, but individuals. At the point in the history of these countries, emerged great leaders who were able to transform and turn around the fortunes of those countries. That's what an Adam presidency or my government will, by the grace of God, lead Ghana, for Ghana to rise again. So I want to make this very clear. Look, you go around the country from north to south, east and west, 70% of Ghanaians are saying that they are waiting for Alan. That if Alan confirms that he's going to stand, then that is their candidate. And so this talk about MPP, Alan going back to MPP, it's all political propaganda. The people of Ghana are waiting for me to make that declaration. And I've already filed as the first non-partisan independent presidential candidate who will become president of the Republic of Ghana, so that we put this to rest. And I'm using this opportunity to also humbly and respectfully request people. So people go around saying that, oh, Alan is the best candidate. But if we vote for him, is he going to win? Yes, because if 70% of Ghanaians are saying that they want change, and Alan represents the change, and everybody is voting for him. So how is it that you waste your vote? It means that you vote, the next person will vote, the other person will vote. Alan will then become your candidate and your president. You know, and particularly for the youth. People talk about the fact that MPP and NDC, they have 40% of the vote. They don't have really 40% of the vote. In fact, both NDC and MPP do not have more than 1 million registered voters. They don't have that. I'm the founding member of the MPP. I was a founding member of the MPP. both MPP and NDC do not have more than 1 billion registered voters. Go and check their books. You know, they were all feeding on the fact that, oh, it comes to election time and there's really, you have no option. It's either MPP or NDC. But this time, they have a viable alternative in Ireland, because I've preached unity of all my years to vote for somebody not based on the record of their parties, but on his own record and on his own credibility.
Right.
I mean, whether it's in Ghana or in Africa or globally, you will see the joy and excitement that we receive the news of an Alan presidency in Ghana. But the decision is yours as Ghanaians. If everybody says that they want change, vote for change, vote for Alan. Alan will become president and Ghana will rise again.
Let's now, brilliant. In fact, you've won my heart over.
So I have one vote.
Oh, you have one vote. But let's look at the campaign proper. Okay, what has been the reception so far? Take us through where you've been so far. I know that you set up a Zongo movement, you know, and that was successful. Take us through where you've been so far. What can you also let us know the journey? To
the president, to the general election.
Yes, to the general elections.
I think we are at a point where now I have no inhibitions about letting the people of Ghana know about what my strategy has been. Because I'm a strategist, I'm a political strategist, and people who have been in the MPP know the value that I brought into MPP when it comes to political strategy. Now, I've always said that I'm a people's man. And so my whole campaign has been predicated on reaching the people directly, having a direct contact with the people, because they are the ones going to vote. And I want them to have a sense of who I am and to have that sentimental attachment to me as an individual. Because that's what is important. You are voting for an individual, not a party. So I need to come to you for you to know me, for me to know you. And then so based on that, the starting point for my campaign was visiting the markets. And I've done that throughout the country. And I can tell you, because I've been there, because it's the marketplaces where you actually get a feel of what the people are looking for. Because when you go to the market, there are two people who converge in the market. Those who are selling and those who are buying.
Right, yeah.
And these are ordinary people. And when you go into a market and you judge the level of enthusiasm that is shown, you know whether you have a positive outcome, a negative outcome. And in all the markets in Ghana, the organic eruption of love, it's amazing. I know it's the act of God, but when people see me, because if you don't have that courage, you cannot walk into the market and think that, because they woot at you. But I go into the market, I don't boss anybody, I just insert myself to the market. And you can see the level of enthusiasm. People just so happy, you know, to see in every market in Ghana. So that has been one of my campaign. Then I've also done what I call the meet and greet. Yes, the markets are important, but it's not everything that happens in the markets. You have to get into people's homes. You have to get also onto the streets. Meet and greet. That's what I call the meet and greet. So there are market tours, but there's the meet and greet. And last week, it was all over the news. I just threw myself into the streets in territories where originally one would have thought were the preserve of, let's say, the NDC. I went through Nima, through Mamobi, all those areas, and I mean, it was amazing. The eruption of love, you know, that you are the one that they are waiting for.
When are you going to our hometown?
Edina.
When are you going to Edina? When are you going to Asante Mampong? When are you going to Ejoso? When are you going to Konongo? When are you going to
Bompata?
Oti, Bompata, Techiman?
Yes. My ancestry also comes from Techiman.
Hey, then propaganda man.
I can tell you, you know, in Manshia Palace. The people who are called Abenasi, that is the group called the Abenasi, which is part of the Jasi. They actually dress up Asante.
Oh, wow.
They select the cloth, in fact, because many years back, the Queen Mother of Techiman, through the wars between Asante, was brought to Asante or to Ashanti out as one of the archons of the war. And she was so beautiful and so well decorated that the Asante at that time decided to give her a resting place in Kumasi and then created what is called Patasi. You've been a Kumasi boy, the whole Patasi community. So we were descendants from Techiman, and this Queen Mother then was so revered by the Asante at that time that he literally created this community just for her.
Wow.
And then used her descendants now to be the ones who dress the Asante.
Wow.
So I'm part of the Abenasi.
You are part of the Asante.
So
you are part of the
and then everybody who knows that my lineage in the Joso, because my grand uncle was the chief of the Oman of Joso.
Wow.
During the Yasantua War when the new chief was installed. So I have my roots also grounded. And then my family side also, the Wilsons, the great Wilson from Amina. That's my father's, my mother's father. Interestingly, my mother's father called A.J. Wilson. He was the highest ranking Ghanaian in the colonial civil service. Yes, assistant colonial secretary.
So can you speak Fanti?
Hey, now what are you, man?
Oh, fantastic. Thank you very much. It's been a wonderful conversation.
Yes, good.
Well, so all too soon, we've come to the end. The producers are signaling me that we have 2 minutes. But with the 2 minutes, where is the bus of Alan stopping next?
So, I have found.
Yep.
And so the campaign is now starting.
Right.
And apart from the market tours, apart from the meet and greet, the other exciting one is what I call the caravan tours. Now the caravan in every region is going to move from town to town, which is tough. So we are not concentrating on only the big constituency capitals. We are going further down than even what the traditional parties have been doing. We are going from town to town with a caravan, you understand?
Yeah.
So we touch base in every town along the way. Right. So that's one major, And then we have our village encounters. Village encounters where, apart from those of us leading members who are on the caravan in each region, then we have our grassroots operatives also engaged on what we call the village encounters. Look, so in terms of strategy, I can tell you.
So will be there.
Everybody's going down to their village for
awesome.
And look, and that's what politics is about. We are there for the people, and we have to get down. So in terms of strategy, that's why I'm not worried if I expose it, because even if you want to copy it, you don't have the original. I keep the God has given me the original copy. Yes, you will never give it. Some of my competitors have started, trying to replicate what I do. I do meet and greet, then they go do meet and greet. I do market tours. You see, it can never be the same.
Right. Thank you.
The real original.
Thank you very much. Yes. No duplicates here. But thank you very much for speaking to us again today on Alan Speaks Primetime TV show. My name is Kwame Owusuda, so I trust that you've had fun today. Of course, talking about the policy and also talking about the campaign and the declaration that he has made. I want to encourage you to continue to support Honorable Alan Kojo Chamatem and the movement for change, and perhaps we'll be able to change the face of Ghanaian politics. I'll see you again next time. Have a nice day. Bye-bye.